Welcome to the Thinking Practitioner Podcast,
a podcast where we dig into the fascinating issues, conditions, and quandaries in the massage and manual therapy world today.
I'm Whitney Lowe.
And I'm Til Luchau.
Welcome to the Thinking Practitioner.
Books of Discovery has been part of the massage therapy and bodywork world for over 25 years. Nearly 3,000 schools around the globe teach with their textbooks, e-textbooks, and digital resources. Books of Discovery likes to say, learning adventures start here. They find that same spirit here on the Thinking Practitioner podcast, and they're proud to support our work, knowing we share the mission to bring the massage and bodywork community thought-provoking and enlivening content that advances our profession. Instructors of manual therapy programs can request complimentary copies of Books of Discovery's textbooks to review for their use in their programs, and listeners like you can explore their collection of learning resources for anatomy, pathology, kinesiology, physiology, ethics, and business mastery at booksofdiscovery.com, where you as a listener can save 15% by entering Thinking at checkout. And today, I'm very honored to be talking to Fabiana Silva. Welcome to the show, Fabiana. It's such a pleasure to have you here with us.
Thank you, Til, for having me here.
You are a physiotherapist. I'll introduce you a bit, and then we can talk some more about our topic today. You're a physiotherapist with a master's in epidemiology, currently pursuing your PhD in rehabilitation sciences at UFC SPA and the Vrije Universiteit in Brussels. You serve as president of the Fascia Research Society and direct the Fascia Research Center in Brazil. You're also CEO of Circle Health Education and sit on the academic board of the ASOMI College of Sciences.
Mm-hmm.
You've contributed chapters to the book Fascia, the Tensional Network of the Human Body, which was really helpful for my deepening understanding of fascia as I wrote my own books. And you served as a technical reviewer for the Portuguese edition of Tervel and Simon's Myofascial Pain and Dysfunction, an old classic. You also teach extensively across Latin America on fascia sports and manual therapy. And if that's not enough, I want to hear about your presentations at the upcoming Fascia Research Congress, which is in just a few months in New Orleans, and the insights that you, with your presentation and the Congress in general, are going to bring to the field. Great.
Yeah. Thank you. At the conference, I will talk about the relationship between fascia and the vagus nerve.
Yeah.
And for me,
Fascia and the vagus nerve. Tell us about how you got interested in that, or what drew your attention there as a topic.
Yeah. I started working with fascia a long time ago as a practitioner, as a PT. My background is manual therapy. And after I started to read more about the autonomic nervous system and started to be with patients with chronic issues, like gut issues and etc., and the vagus nerves, shows to me that this can be a pathway to explore. So I started to study and work with the patients with a auricular transcutaneous vagus nerve stimulation. That is like a way to treat the vagus nerve that is we have a lot of research about it. And it's approved by the FDA for depression, for stroke rehab, and for some types of migraine. So, and seizures too.
Seizures. So
yeah.
you think, just to clarify a little bit, transcutaneous stimulation of the vagus nerve, this is through the skin. This is not an implant. Those are also sometimes used.
No.
But you were inspired, or you're taking information or ideas from this fact that we can stimulate the vagus nerve through the skin. This is electrical stimulation in this case?
Yes, it's electrical stimulation. In physiotherapy, you already use a lot of transcutaneous electrical stimulation that is not invasive, and we can apply inclusive in patients with cancer, for example. There is no adverse events. And this type of stimulation you can use to stimulate the vagus nerve. And the ear is one local that the vagus nerve is more superficial. So you can pass the electrical stimulus through the skin and fascia, etc., and stimulate the vagus nerve. And the other place that I use is to stimulate near to carotid sheath here at the neck.
Carotid sheath is in the neck. Yep.
Yeah. Yeah. And it's another place that you can do the transcutaneous stimulation that is non-invasive. There is a few contraindications, but with more indications and with good results. So I usually combine two: manual therapy, electrical vagus nerve stimulation, the respiratory work, and movement as well for the patients.
Let's get into the specifics in a minute, but can you refresh us a little bit on why the vagus nerve would be a target, why it would be so important?
Yeah, two principal points. The first one is the action of the vagus nerve to bring us the inflammatory process that is necessary for recover. And so the vagus nerve starts the inflammatory process because he have a relation with the immune system. So this is quite important for us. And because
So the vagus nerve is a really key player in systemic inflammation. Like you said, it helps start that cycle, which is so important. And also, as I understand it, helps modulate it or time it or help wind it down, those kinds of things.
Yes. And with chronic issues, in acute, but in chronic issues, we have like a disbalance between the pro-inflammatory cytokines and the anti-inflammatory cytokines. And the vagus nerve improves the anti-inflammatory with the pass of the time. And the other important thing is that vagus nerves is in relation with a psychological functioning of our body. And in chronic issues, we have a lot of patients with depression, anxiety, and sleep problems, and etc. And the vagus can help us to modulate these other things, not just that ones that are directly linked with inflammatory problems. And so vagus have a peripheral but a central influence that is really important for us, and it's the major nerve of the parasympathetic nervous system. And so this is why
the parasympathetic nervous system, again, being the one responsible for repair and rest and recovery. And
Yes.
often the thing we're thinking about when we're doing calming therapies or relaxation-based therapies, often thinking about an autonomic state. And like you said, the vagus nerve is one of the primary structures involved with that.
Yes. And it's other way how we can improve the vagal tonus is, for example, with respiration, with manual therapy, with exercise or body practical movements that when the person is engaged with their own body, they are taking attention, they are trying to calm down. So this can regulate the vagus tonus too.
Just being engaged with our bodies, just moving, just paying
Yeah.
attention to our somatic experience, that regulates the vagus nerve as well, you're saying?
Yeah. Deep breath for 5 minutes. And because the vagus have a afferent power, so he always giving notice for the central nervous system what's going on in our body. is something like us in the fascial field we call interception. And Professor Stephen Porges, that will be at the FRC with us this year, he talks about neuroception. It's a different concept. And
Neuroreception, Stephen Porges. Yeah. He's, by the way, he's going to, I just heard this morning, he's going to come join us on the podcast for an episode. We'll talk to him about that. I'm excited about that as well.
Amazing. Yeah, I like his work. He's gives us the foundation of the vagus nerve stimulation. For me, something that is really important from his work, it's about safety. And when we are with a patient that have chronic problems, that have fear of the movement, that have fear of a lot of things in their lives, we need to help them to go to a place that they can be more safe. And some people are not safe with their own bodies. And this can be really stressful, and this can cause or having the feeling more pain and more stress and more in a sympathetic predominance. That is something that us as massage therapists, physiotherapists, yoga practitioners, and so on, we can help these people with these issues.
Okay, so you're talking about the power of the vagus nerve in so many different areas of experience, including autonomic nervous system, psychological effects, inflammation, sleep, etc. How does that relate to fascia? Isn't fascia just tissue?
At the beginning, it was for a lot of people, but now we know that the fascia is the glue, but not just this. And fascia,
Say that again. I'm sorry. Fascia is the glue, but what?
the glue that puts everything together.
Okay.
And thinking on vagus nerve perspective, fascia brings the interface, the tissue that gives passage to the nerve, because the vagus nerve needs to goes out of the jugular foramen and goes down through the body, passing for a lot of fascial sheets, a lot of fascial connections. And one of the problems of the low vagal tonus can be in this interface that the nerve needs to go through. If you have a scar tissue on fascia, like at the neck, for example, or gut, or others at cervical, for example, or if you have like a concussion, you can bring a dysfunction, a tecidual dysfunction, that can cause a low functioning for the nerve, for all nerves, not just vagus, but we are talking about vagus right now. And this can give to the nerve less axoplasmatic fluids. This can bring to the nerves less mobility, and this can cause inclusive pain for some people. And so fascia have a mechanical protection for the nerves, including the vagus nerves. So it's why it's important to have a health fascia for the good functioning of the vagus nerve, for example, and other nerves. But it's not just this, because fascia, like vagus nerve, is a sensory organ. And always, second by second, it's giving information for the central nervous system about what's going on at the periphery. And the vagus nerve, regulating the autonomic nervous system, will bring us as we say, not the afferent, but the efferent responses, including, for example, it's not just motor and sensory, but we have a vagus nerve improving our stomach acids, for example, improving our gut movements, improving our liver work, and etc. And so this communication occurrence, it's not it's something autonomous. It occurs every time, every second in our body. And if the fascia is dysregulated or in dysfunction or in with fibrosis, for example, this information can go in a wrong way to the superior central nervous system or etc. And the efferent response of the vagus can be disbalanced, for example. So this is not just a mechanical relationship between vagus and fascia, but as it's a relation about the information of the things that are going on in our body. So it's really important.
You're saying the vagus nerve has many, let me see if I can summarize. Vagus nerve has many functions. It is a mechanical structure. It is a nerve. It is surrounded and mechanically protected by fascia.
Yes.
And qualities of that fascia can influence its functioning, both mechanically, but you also talk about axoplasmatic relationships, inflammatory processes, things like that locally that can change the functioning of the nerve itself. Perhaps density, you said, or certain places where scarring or tissue problems might change the functioning of the nerve, both in its role as an afferent signal for the central nervous system, but also you mentioned its role as an efferent pathway for the central nervous system's effects out into the body.
Mm-hmm.
Did I get that right?
Perfect. Yeah. And it's
All right.
something so good to study and to learn about it. And at the Congress, we will have a lot of opportunities, not just with Professor Porges, that will be amazing. It's like something that a lot of people want to know him and stay with him, but other practitioners that we will present about vagus nerve, about the chronic inflammatory issues that we have a lot, including post-COVID, with the long COVID situation that brings a lot of issues from patients, like fatigue and chronic pain, inflammatory pain, etc. So we will talk about this at the Congress. That is like a reality for us right now.
This is all a topic that's dear to my heart, having been through chronic health conditions myself. But I'm also going to get a chance to do a short hands-on workshop post-Congress about inflammation and fascia. So I'm looking forward to that, bringing that.
I will be there to
Okay.
watch.
And the vagus nerve has, for a long time, been a place that I've focused my attentions. There was some really interesting research maybe 10 years ago, maybe a little more, with Kevin Tracy around using vibration to stimulate the vagus nerve in the ear. Of course, there's the transcutaneous electrical stimulation you talked about, which is pretty obvious and probably really great, effective, and easy to research. But as manual therapists, my assumption is we're also having effects through our touch and through the mechanical and other kinds of stimulation we get by touching those same areas. So I leverage that ear a lot, and the little area behind the ear where the vagus innervates for our migraine approach, and I'll talk about that in our inflammation workshop as well. So it's there's not that many people talking about it. I appreciate seeing the topic that you're speaking of and then these things you've mentioned today. Any other practical considerations we can brainstorm together here before we turn our attentions to the Congress itself? What would you say to practitioners who are interested in starting to use these ideas in their hands-on work?
I use the hands-on approach too on vagus, especially to the craniociptal myofascial release there, because it's when vagus goes out, and we know when we work in this region, the suboccipital region, we have, as we know from the research, we have a lower salivary cortisol level, and a improvement at the anti-inflammatory cytokines.
So let's translate that a little bit for people. That would imply that there's a more robust response to stress, ability to recover from stress more, and
Mhm.
lower activities of systemic inflammation, just as a result of working on the vagus nerve in those places, you're saying.
Yeah, and this is a technique that is quite common for those that work with craniosacral therapy or manual therapy for PTs, for example, the suboccipital release.
Yeah.
Manual release I use a lot, and we have some research showing the work at the sternocleidomastoids muscle and area.
In the front of the neck there, yeah.
Yeah, in front of the neck. That it's quite interesting. And 2 years ago, I did a review about the fascial target approach at the guts, and we found at this review that we have good improvements for people that have like esophagic problems, like reflux, and for people,
Esophageal issues, yes.
yes, and for people that have low back pain, and at the same time they have gut problems like constipation, for example, they improve when you use a fascial target manual therapy at the guts. So this is really interesting, and I use it a lot, but we don't have evidence for manual therapy in all the pathway of the vagus nerve. So it's something that we really need to work on it. Yeah.
And we don't have the studies you say, we haven't done the research there. We do have, decades, centuries, maybe millennia of clinical experience. Like you said, there's so many people that work the suboccipitals in response to a headache. We do that for ourselves sometimes. So there's, maybe we're finding some of the mechanisms that explain or can help us get even more specific about things we know already in the manual therapy traditions.
Yes, yes. And of course, some things that we do, we will never see in research.
What do you think of?
Because to do a randomized controlled trial that simulates what we do in a clinical moment, in a clinical practice, we can't have all the pieces of the puzzle
Yeah.
in a randomized controlled trial.
Oh.
Because the result that we have, it depends of a lot of things, not just the technique, but depends about the connection between the practitioner and the patient or the client. It depends about the environment. It depends about the level of stress. It depends about a lot of things. It's not cause and consequence. It's like more an interaction, and we will give one input to one scenario, and we will have an output. Of course, we are hoping that the best output is less pain, more mobility, and etc. But the interaction depends of a lot of things: the history of the person, their beliefs, their culture, and a lot of things. And so it's why when you look to the randomized controlled trial about manual therapy, the results are just low or moderate. You can choose each technique that you wanna. Mobilization, like thrust or massage or fascial target therapy or etc. The results are not outstanding. The results are not high as we expect, because some pieces of the puzzle will never be there in a research environment.
That's
It's my
yeah, that's an interesting thing to keep in mind, that especially as we think about research, it's designed for, it was, originally used around measuring pharmaceutical interventions, which are much easier to reduce to a single factor. Even then, there's pretty strong arguments that the context is sometimes the most important part of the experiment.
yeah.
And just as a mental exercise, there's some really interesting research design that does include a lot of contextual factors that is still interesting to compare one context to another, for example.
Mhm.
That's something that I want to do more learning and thinking about myself. But your point is a good one, that there are some things that make manual therapy or massage therapy or body work effective that are really difficult and not suited for the randomized clinical controlled trial.
Yeah.
That
But as a research society, we and I wanna support this. I wanna see more context studies, more pragmatic studies. Like, for example, you don't treat everybody with low back pain in the same way, right?
right?
Yeah. But when you do a study, you treat everybody with the same techniques, in the same uh, repetition, with the same thing.
Mm.
And for doing pragmatic studies, we can um, keep in mind the context, but we will have some things that we will lose, but at least the treatment can be more specific for that individual. And it's why I'm looking for this type of study, the pragmatic studies that can bring us a little bit more uh, things more closer to the things that we do at our offices.
You're the president of the Fascia Research Society. How how does this thinking affect your mission there or the role of society in supporting our field?
Uh, I'm new on this task, like 1 month, but I have a lot of ideas together with the board. And for me, the first one is that thinking on the fascial field, the quality of the publications are not so good.
Hmm.
We have a lot of studies about fascia published in predatory journals.
Predatory journals, can you tell us something about what those are?
Yeah, predatory journals is that ones that don't have their first goal is not quality. Their first goal is to publish, and the researchers need to pay to publish. So they are
For a
some
fee as a researcher, or even not as a researcher, I could go to a journal or a service and have a study designed and published and put out in my name showing a particular result for a fee.
yes,
Yeah.
yes. Every week I receive emails from the journal, blah, blah, blah. Oh, we are going out with our next edition. Do you have some research to publish with us? Why are you inviting me? So a lot. If you had a lot of people applying to publish you don't need to invite me, you know? And it's not just me, Fabiana. They send it to a lot of people. And these predatory journals, the quality is low because they don't have good reviewers that will look at the study and say, please change this, change that, wrote in a different way. No, your study can't be published by us. And so it's not a critic and constructive work. And a lot of studies from fascial field are published in this type of journal. And so it's something that we can really, really support the researchers to do in a different way. And another thing that we are looking for doing is have FRS have our own journal with good reviewers, with an editor that can put the scale high, not low, because we deserve the best quality of research that we can have. And this is not now a reality. And it's not a criticism for those that publish it there. I already did. And after did the publication, the journal that I published entered in that list. And that's it. I already published it, and okay. But we can help the researchers. We will have our own journal, and we are looking for more partnerships with other research associations, like International Association for Studies of Pain, IASP, that is really good. The American Physical Therapy Association. We need to be together with other societies to show how we work, to show that we can put fascia on a lot of other fields, like yoga, the International Urogynecology Association, and fascia can be in a lot of places. And Fascia Research Society can give the opportunity or can put these people together. And for this Congress in NOLA this year, we are with a NEAMTPT offering continuous education credits. So there is something that is amazing. And we are with a Australia Massage and Myotherapy Association too. And we are really happy for having these people with us, supporting us, and we are supporting them too. So
They're the biggest massage therapy association in Australia, so it's great that you have them on board as well.
yes.
Let me go back for a second. You said the 7th International Fascia Research Congress is coming up in NOLA. You said, for listeners who don't know what that is, that's New Orleans, Louisiana.
Yes, New Orleans. Yes.
And that's coming up. Let's just name the date. When is that? August
From 10th to 14th.
10th to 14th in New
Yeah.
Orleans.
But
We'll
we
put
will start on 8 with the anatomy dissection workshop with a team of stars like Carly Stecco, Gil Hadley, John Sharkey, and Gabrielle Venn.
Gil and John have both been guests on the show. We hope to, and Antonio Stecco has been a guest on the show. So they're running a dissection workshop before the Congress. That should be pretty exciting.
Yeah, and they will have histology and ultrasound together, and will be really, really interesting. And it's good, as I mentioned, the interfaces, the fascial pathways for the nerves and etc. Anatomy and nose anatomy is really important for this and other things in our practice.
What makes the Congress unique compared to other scientific or academic conferences? What would you say?
Yeah, The first thing is that this is our Congress. This is the Congress from people that works with fascia day by day, like you and me. And this is the Congress of our community. And we need to improve this sense of community in the fascial field. The sense of collaboration. And as Professor Carol Davis mentioned it to me, she says, I'm feeling this year with the program that you and the committee of the scientific committee of the Congress, I'm feeling the community sense together again. I'm feeling that I'm part of this again. Because we will have at the Congress a lot of opportunities for change the experiences, the special interest groups, and we will have one about manual therapy and fascia, one about movement and fascia, and one about biotensegrity. And from these special interest groups, we will create task forces, and the society will work after to write a clinical recommendation, including the clinical recommendation for the use of tools and rolls and balls and etc. So we will have a lot of opportunity to really honor our mission, that is bringing the gap between clinical, the practitioners, and the researchers. And we will put them in at least 3 roundtables. So they will discuss from a research perspective and from a clinical perspective. And so this is the event. This is the Congress that someone who works, someone who likes, someone who study fascia needs to be there, not just because they're researchers, but because the practitioners that will be there too.
That's something I've always enjoyed. I've been to most of them, and I've always enjoyed the practical applications. And of course, that's my bias as a practitioner. I'm always looking for how can we use this information. In fact, that's
Mine too. It's
yeah. Many of us who are in the clinic want to know this is very interesting, but then how do we use that? And I've always been really pleased at the conversations that happen there and at the high number of practitioners in attendance. It's not just academics and researchers. And
yeah.
I'm imagining this, but it looks like this year's roster of presentations has an emphasis on practice and application too. There's quite a bit of that I saw.
Yeah, and it was something that people talked to me after Montreal.
Montreal was the last Congress. People talked to you about that. Yeah.
Yeah, it was amazing, and I enjoyed a lot. But some people was saying, "Oh, I need more practical things. I need to uh, think about my work. I need more application of this." And so it's like I put this as a mission for me. And this year, we are already doing this.
Well, you have me leading a roundtable discussion one evening on how do we put this into practice. So I'm looking forward to examining that question together
Yeah.
very specifically.
Mm-hmm. Mm-hmm. Yeah. And we will have morning movement sessions every day, and morning lectures about manual therapy application, manual therapy and movement and etc. We will have a pre and post Congress workshops and the networking sessions. So a lot of opportunities for people, and the abstract presentations and poster presentations too that have, and we have a lot of practical works that will be shown there.
I'll be talking to Dr. Robert Schleip in a few weeks about the Congress, talking, like I said, to Dr. Stephen Porges about the Congress. And then I hope to have a couple conversations while I'm there with people and share them with our listeners afterwards as well. Will the Congress be online, or are there recorded options for participating for people?
No, the Congress is in person.
Yeah.
And it's a not easy decision, but we decided to maintain in person, and because it's in 3 years is the opportunity to have everybody together, and we started planning this Congress 3 years ago, of course, and we are already planned to be in person, so we will continue to do this.
Come in person, come be part of it, or tune into the podcast, or do the research and read up on some of the things that are going to be happening there. I'm looking forward to it. Anything else you want to tell us about? What note do you want to leave us on? Fabiana, thanks for your time today. What do you want to leave us with?
Just say that the plans for Fascia Research Society are really good, about the journal, about more membership opportunity to work together with the society, and we will apply to a multi-center myofascial study to a lot of things, that the guidelines, the recommendations. So for me, it's one duty of the society. Try to guide the people that work in this field. And so we will do this. And we'll have the nomenclature work. We have a lot of, now we will start with fascia and cancer. We'll start at the Congress to work with Professor Werner Kingler and Stephanie Otto from University. And we will have good news, good things, and we just want people together with us and enjoying the Congress and the society too, and feeling that they are part of this.
So the Fascia Research Congress in New Orleans, August 10th through 14th, 2025. We'll put a link in the show notes. The Fascia Research Society will also link to there. Fabiana, thanks for joining us today. Let me go ahead and thank our closing sponsor also, which is ABNP. They are proudly supporting us, and they are the premier association for dedicated massage and bodywork practitioners like you, the Associated Bodywork and Massage Professionals. When you join ABNP, you're not just getting industry-leading liability insurance, you're gaining practical resources designed to support your career. From free top-tier continuing education and quick reference apps like Pocket Pathology and 5-Minute Muscles, ABNP equips you with the tools you need to succeed and grow your practice. ABNP is committed to elevating the profession with expert voices, fresh perspectives, and invaluable insights through CE courses, the ABNP podcast, Massage and Bodywork magazine, which features industry leaders like Whitney Lowe, who wasn't able to be here today, and myself, Til Luchau. Thinking practitioners like you can get exclusive savings on ABNP membership at abnp.com/thinking. Join the best and expect more from your professional association. Thanks to you, our listeners, and to all of our sponsors. Stop by our websites for the video, show notes, transcripts, and extras. Whitney's site is academyofclinicalmassage.com. My site, advanced-trainings.com. We want to hear from you with your ideas or input and feedback about the show. Just email us at info@thethinkingpractitioner.com or look for us on social media or YouTube under our names. Again, I'm Til Luchau. Whitney Lowe, my co-host, will be back. People can check out Whitney's channel, where he has a YouTube channel where he has lots of resources for rehabilitative massage. And we would appreciate it if you would rate us on Apple Podcasts. It really does help more people find the show. It helps our sponsors know that we're thinking of them and giving them value as well. So take a second. It takes about 8 seconds to click your podcast link and go there and just rate us. Tell your friends, share the word. Come on back next time. We'll have even more guests. Fabiana Silva, thank you so much for joining us today, telling us about your research and the Congress. I appreciate you taking the time.
Thank you too.